Peace, family, peace. How's everybody doing out there? We are back with another episode. Black Magic 363 in the building. What's up with y'all? Let me make sure y'all can hear me. Let me make sure. I don't know why I'm not seeing my audio. Okay. I think I see it now. All right. All right, listen, y'all. Listen.
Make sure. I
I
don't
got
know
a
if
new
I'm seeing.
I got a new
Tag.
yeah.
Okay.
Yeah, I got a new guest here today, and we getting ready to learn some important stuff about a very important part of our body, the eyes. And this is information that the community definitely needs. So it's going to be a powerful show. Make sure you hit the like button, family. Make sure you get comfortable. As always, we're gonna get to a quick commercial, and then we'll be right back. And I'm gonna introduce my guest. All right, but get comfortable, family. Hit the like button. Tell your friends and family. Share the link if you can. That'll be even better. But we'll be back after this commercial.
Inner Alignment Workshop Through Your Eyes and Your Numero with Dr. Shakirah Moore and King Simon on February 11, 2023. Dr. Shakirah and King Simon. Get your tickets now at linktree/King Simon the Numero Veda.
All right.
Right.
That is a workshop that my guest, along with King Simon, will be presenting in February. But without further ado, Dr. Shakirah Moore, welcome to the platform.
Thank you. It's an honor to be here for real.
Indeed. All right.
Mhm.
Tell the people about yourself, what you do, and what can they expect today with today's conversation.
Absolutely. So I teach and do iridology. So I've been doing iridology for the last 5 years, and it's a way for us to diagnose disease without waiting for chronic ailments to happen. We go to doctors all the time. We go to doctors for years, and then next thing you know, we're diagnosed with some chronic disease out of nowhere. So with iridology, I can help you to see ailments in the iris well before you get a chronic diagnosis of cancer and all of these different things that is plaguing our people. So also deal with herbs. I have herbal packages, but my main focus is teaching the masses that you can truly heal yourself before chronic disease arrives. So we have to stop being a waiting people. We have to be an action people. So that's what I teach.
So, like I said, I've only met one other person that was dealt with iridology. This was like over 10 years ago. I forgot the sister's name, but she had did a lecture and we seen it. It was amazing. And I find this science amazing that you can spot any type of disease or anything within the eye. So I'm very interested in tonight's discussion. So let's start it. Let's talk about the eye. Let's talk about the brown part, or some people's part is blue. Let's talk about the white part. Explain to me what exactly is the eye made, what the different parts of the eye for those who may not know.
Okay, so each part of the eye, I can tell like what kind of diseases is going on. You have the sclera, which is the white part.
Okay.
The color part is the iris, and that's what I focus on, iridology, focusing on the iris itself. So the markings in the iris will show patterns, colors, and different markings. It can even show whether a person has been on drug medication for a long time. So that's what the main focus of looking at the iris, the eyes, to look at disease. Then you have the corner of the eye where you can tell the iron issues. And that's why I ask a lot of my clients when they take their iris photos, because I do Zoom consultations as well, and a lot of people get so surprised that I'm able to look at the eyes, just like how we talking right here, just like how we having this dialogue right here. You send me pictures of your iris and I tell them to pull the eyelid down. I can see even under the eyelid what's going on with the blood, even above that shows the veins. So it's truly each part of the eye, whether it's the iris, the sclera, the eyelids, will let me know your overall health.
Indeed. So give me an example. If somebody's sick, cancer, diabetes, just whatever, what would you see in their eye? What would their eye look like?
So it would have, with diabetes, that'll show the pancreas area. So it would have different markings in the pancreas depending on, I can also see if it's like an inherent, what we call a genetic weakness. That does not mean that you're automatically going to have a challenge or what is called diabetes based upon if someone in your family has it. So everyone is born with something called inherent weaknesses. It's something that if a family member had a weakness in one of their organs, your iris automatically from the womb will show that, reflect that, even in the baby's iris. So if I'm looking in the pancreas, I can let them know if the glucose levels are high, that they need to focus on cleansing and strengthening their pancreas, specific herbs to take to strengthen their pancreas, such as like Gurmar and bitter melon and all of these different packages that I have. So I can tell virtually anything as far as dis-ease going on in the eye, but I do not name a disease. That's one thing. So I don't tell clients that they have diabetes or they have cancer. Cancer can show up in the iris based upon dark, if the eyes is really dark. Like if the iris is very dark, that's where it will show what is called cancers or presence of tumors.
So once you see something in the eye, about how long you think it takes for it to show in the body? Like if you see cancer in the eyes, that's an early indication that cancer might happen. How long after you see that do you think it'll hit the body and they'll be like, oh shit, I got cancer?
So it could be 8 months, it could be 12 months. I had a client where I seen specific markings and patterns in the breast area. And she hadn't went to her physician yet, because a lot of my clients, they go to regular physicians as well. And so I seen it in the breast area, and she said, wow, after she had the consultation with me, she said, this is the first time that my physician asked me to come back after a mammogram reading. And then when she went to her mammogram reading about 2 months later, they said that, there was abnormal cell activity going on in the left breast. And that's exactly where I seen it. So she was so amazed. She started my program, started detoxing. And when she went back to her physician, which I do encourage my clients to do so that we can check if you want to check in that way, and no more lumps on that left breast after she followed the program through. And this is real, family. We don't have to suffer. We don't have to wait until we're 40, 50 to get these chronic diagnoses. I can see this all even in a teenager's eyes, even in a baby's iris, of what that child can possibly face in their lifetime. That's how powerful this science is.
No, I mean, if it is what y'all say it is, and I think it is, then this is why I say we need this. So I'm so excited to introduce you to the community, because this is something that's very much needed. So let me ask you, so the eye, so do different parts of the eye represent different organs? Like the top left, the top right represents that, the bottom left, the bottom right, is it different parts equals different organs? Is that how it works?
You know what? If we can share, if you can pull up the chart, if I could share a chart,
go ahead.
Because the chart, I can actually show, how you can see the organs in the iris.
Yeah.
So am I able to share my screen, or
you should be able to? You should see something that says share.
It says present, I think. Yeah. There we go. Let me see. Let me pull up. I'm gonna pull it up first so that we can see the chart in real time.
Once again, shout out to everybody in the chat. We talking about iridology. We talking about the eyes. We're gonna be dealing with spirituality. We're gonna have a great conversation tonight, family. Get comfortable. And at the end, I'm gonna take a couple of Q&A so y'all could get some good questions ready toward the end. And we're gonna enjoy our Friday night. The sister's about to pull up a couple of slides to show y'all. So just be patient with us. Real quick, shout out to the brother King Simon. Once again, they got a workshop coming up in February, and I'll be sure to ask Dr. Shakirah Moore about that before the end of the show. All right.
Okay. 1 second, family. I got it right here. There we go. It's like real slow. All right. I'm about to share my screen right now. Yeah, I got it. All right. 1 second.
Yeah. Shout out to Yaki Awaken. He does talk about iridology. I'm trying to reach out to the brother. The brother's real busy. I know he got that Netflix show about to pop off, but shout out to that brother. I know he deals with that science as well. So shout out to Yaki Awaken.
So it just says share with it. It doesn't give me an option to share. It just says share entire screen, but it's not letting me like. Okay, I got it. Let me see. Okay,
I see it now.
let me see.
You know what it is? You shared the screen. You got to share a window.
I shared this. Okay, that's what it is. Hold on 1 second.
You shared the entire screen. Share a certain window.
Hold on 1 second. I'm trying to. It says.
Yeah, somebody said first I've ever heard of iridology. Yeah, yes, it's the first you've heard of it because not a lot of people talk about it for whatever reason. I have no idea. Not a lot of people talk about iridology. I have no idea. You know who else I want to get on your family? Somebody who studied the palms. I'm gonna do everything. I'm gonna do the eyes, the palms. Somebody that's in the reflexology. We gonna get into all that this year. You know what I'm saying? We gonna get it all.
I'm gonna share. I don't know if you can see this.
Okay, I see the eye. Yeah.
Now I gotta figure out how I'm gonna pull up the other photo virus here that we're going to talk about, we're going to get into, but the actual chart I'm having trouble pulling up. So 1 second, I'm trying to. Is it a way you can pull it up on your side, or
you would have to email it to me? Whatever you have to email it to me.
Okay, yeah, I don't want to, because I'm like really trying to get this going, and it's only letting me share that. Okay, I'm gonna email it to you right now because for some reason it's not letting me attach the photo here.
Yeah, shout out to Dr. Stevenson, Dr. Laila Africa's his late wife. Okay. The brother passed away. Shout out, rest in power, Dr. Africa.
Wait. Wait, I emailed the wrong thing. Hold on 1 second. Did I email you like a picture?
Oh, I didn't even check it. I'm gonna have to see. Let me see.
Okay, I got it. I sent it. I just sent it. It's for some reason, I don't know why it's not letting me share. So I'm gonna stop sharing my screen on this side. Did you get it?
I got a testimonial you sent me.
Okay, I just sent it. Yeah, there it is.
Okay, I see the chart. Yeah, I see it.
Okay.
I bear with us, family. Have a little patience.
Yes.
I'm about to pull it up right now, family. I'm about to pull it up. Thanks for having patience, family. I truly do appreciate it. All right, let's get to this. Let's get it going.
Yes. There it is.
All right, so yeah, let's. All right, what we got going on here, Dr. Shakirah Moore?
All right, so as you had asked before, like, where you can see the specific organs, the lower part, the left iris shows the left side of the body and the right iris shows the right side. So that's where you'll find the liver, you'll find the gallbladder, you'll find the ascending colon, and then you find the descending colon on the left iris. So different markings in each area. And also the size and the shape of the marking will tell me how chronic the tissue is in that specific organ. So that's why it's important that I don't name a disease, because I'm not looking at, because disease names are just that. That's all it is. It's just naming disease after the symptoms. If you actually research and study the etymology of each disease name, it'll just show you the symptoms. Like diabetes is just showing you the symptoms of an overactive pancreas. High blood pressure is just the pressure against the heart. It's not really dealing with the root cause of disease. And so that's where the iris comes in, where, I'm looking at the kidneys, and depending on, I'll show you some photos as we move along, photos of a chronic kidney, a chronic liver, even the thyroid. And what's so interesting about the thyroid, because so many people get overlooked with thyroid diagnosis. And the reason why is that doctors can only see a chronic thyroid when both sides of the thyroid is out of whack. So if the right thyroid is out of whack and the left thyroid is fine, they'll say, oh, you're fine. your thyroid test came back fine, but then 10 or 5 years later, 3 years later, you have nodules, and they're like, wait, how did it come up all of a sudden? It's been there. It's just that their tests are not advanced enough to see both sides of the thyroid, or both even other organs. So that's why we must not wait, and be on our knees when it comes to doctors trying to find disease in our body, because the eyes, you have the answers with you all along. That's what I teach my clients. You have the answers. I'm just here to help you decode it.
Dr. Shakirah Moore, do you notice a difference out of all the patients that you've dealt with between meat eaters and vegans and the way their eyes look?
Yeah, I've noticed the difference. So even with vegans, that doesn't necessarily mean you're healthy. So I'll go into that first. So I've had vegans come to me. They're stating that, they've been vegan for 2 years and they're still having issues, but the challenge is that when you go vegan, that's not enough. You have to pinpoint exactly what organ is weak in the body that you need to work on. So all day, every day, we're on Instagram, we're on Facebook, we're on all of these social media sites, and everyone's telling you what herb to take. Oh, take this, take that, take this, take that, and you start, buying up all these herbs. But is that really, what you need? So with Iridology, I'm able to help you to pinpoint exactly what herb, what nutrition, what plan you need for how long to get you on the right track of health. And I have many clients that come back 4 months later, 6 months later, stating that, they feel better. They were back and forth to doctors. They could not figure out what's going on. And boom, they had their blueprint. That's what Iridology is. It's your divine blueprint so that you do not have to run in circles when it comes to your health.
A major problem with women in terms of their health. I mean, a huge problem that I've noticed just when all my encounters with women that I come across is that they have fibroids. They're suffering from fibroids. So what do you notice? Because sometimes it'd be a little too late when a sister recognizes she has fibroids and she wants to give birth, or she, so she's old. What can they look for? What do you look for to spot fibroids in a woman's eyes?
Is the cursor? Can you see my cursor?
No, I don't.
Okay, so if you see, look in the right, even both the right and left iris will show the uterus here. Okay, and I can actually see if even a 16-year-old girl can have possibly have fibroids in her late 20s and 30s, because that's around the time where it's diagnosed. There's a difference between being diagnosed and already having the disease brewing in the body. So I had a 16-year-old girl where I looked into her iris and I told her, I asked her, how her cycles, is, and asked her, standard questions, and based upon looking at her iris, that she would be the perfect candidate for what is called fibroids. So it'll show up in the uterus area of each iris. And depending on how big the marking is, how dark it is, and I'm going to pull up some iris photos to show you the stages of tissue inflammation. And then that'll let me know, okay, this person, this client has fibroid cysts in this area, and then we'll do a specific cleanse based upon the stage. And that's another thing, we have to know what stage we're in so we know the strongest herbs to take. Just taking raspberry, just taking one herb for fibroids is not enough. You need like a whole package, like wild yam root. Wild yam root stops the growth of fibroids. Then you come in with dong kai and red raspberry and white willow bark and yarrow and all of these different herbs that's in my blend to bust it up. Blood root, red root, all of that.
Interesting. So looking at this chart, I mean, I see the liver, the lungs. I'm gonna just start naming more, family, because I got a good question. The liver, the neck, the lower back. What do we see? The breast, ovary, abdomen, spleen. I mean, it goes the neck. It goes on and on and on. So all of these organs, you could see them within the eye. Now they say eyes are the window to the soul, and we know that our number one food source is the sun, because we only eat food to get the light that the sun gives these plants, or whatever that, whether the animals eat the plant had the light in it from the sun, whatever, we're electromagnetic beings. So my question to you is, all of these organs within the eye, if I sun gaze every day, am I healing every organ within the eye? Because I see everything within the eye. So am I healing everything when I sun gaze?
No, not necessarily. So if you're sun gazing, it's not going to pinpoint each organ. I understand the question you're saying, like as far as the organ regions of the eye, and you sun gaze, is it going to hit each organ?
Yes.
Not necessarily.
Okay. Okay.
It just shows. This just shows the location.
Oh,
This is
okay.
it's like a clock. If you look at it,
Yes.
it's like a clock, and it just shows the location of the organ. Sun gazing is really good, of course, for just heightening your frequency, heightening your alertness, and also it's really good for the pancreas, the kidneys, and just especially if you're into meditation. If we go into that, we can talk about that as well. But no, it won't just heal specific organs. These are just the locations.
So you mentioned meditation. What does meditation have to do with the eyes?
No, I mean, like as far as we was talking about, like sun gazing, like if someone,
Okay.
it heightens that if you're sun gazing and meditating. Mm-hmm.
No, definitely. Okay. So what about people who have different color eyes? Let's talk about the different colors of eyes. I mean, when I was young, coming up and used to hear the Nation of Islam talk about the blue-eyed devil, and a lot of people associated blue eyes with being evil, and some people associate brown eyes with something. But talk to me about the different colors of eyes, and does that have anything to do with certain personality traits?
Yes, absolutely.
Ooh,
That's a
okay.
really good question.
Okay.
So, people with blue eyes would tend to have more lymphatic issues. That's why, like, a lot of times, Europeans, they have a lot of issues with their tonsils. They have a lot of issues with their sinuses. We're always hearing about that. So the blue eye will always tell that. As far as personalities, if you look in the brain area, each part of the brain will let me know what kind of personality traits that each individual will have. And I'll be touching deeper on that in the class on February 11th, how to access the polarities of your personality through the iris. As far as if you're on a certain frequency, if you're on a certain vibration, what you should be doing to keep yourself there. And if you're not doing those specific activities, then this is where you're gonna go. You're gonna go lower if you're not raising yourself. Like, for example, I did an iris reading maybe a few days ago, and I told her that you would do well with art, just being into the arts, making yoga, just constantly flexibility, working out, teaching people how to work out, gardening, just different things that she would be good at based upon markings in the brain area. So a specific color would not show the personality, but the brain area does. Now, a brown iris, that will be more issues with the heart, the blood. And as melanated people, we are heart people. That's why we have the most high blood pressure. But it's not because of us. It's because we are heart people. So the blood pressure will always be a little higher than any other group. So a lot of times I tell my clients, when you get a high blood pressure reading, it does not necessarily mean that you have high blood pressure. That's just who we are as a people. And they change the numbers all the time. Like
excellent.
Before they had it, I think it was like 140 over 90. Now it's like 130 over 70 or something like that. So they lower it, and now you go in for a blood pressure reading and it shows high, but is it really high? Because the medical establishment is not geared towards diagnosing melanated people. Is more geared towards diagnosing Europeans.
So this is why, family. So everybody should have an iridologist and a physician, huh?
Yeah, I mean, yeah. You can. I say, because we have this thing in our community where we don't trust doctors. We're like, oh, I don't trust doctors. I'm not going to doctors. But then we're not living a certain way to avoid going
To
to the
avoid.
doctor. So
Excellent point.
I tell people
Excellent point.
that, you know, that's the ego, because you have to
Mm.
live a way in order to avoid using their establishment. Every establishment is there for a reason. And I say the greatest accomplishment of the Western medical community is their trauma and recovery unit. If you're walking around with a super high blood pressure, you're going to need that to stabilize you, come home and do what you need to do. So we do need that system as far as trauma recovery. You get shot and stabbed, you're not going to use herbs, you know. So we have to let that ego go. And if you're going to live on that righteous path of taking care of yourself, cleansing, you know, eating right. And I'm all about balancement. You know, it's not all about just being vegan to be healthy. You know, my grandmaster, he's 77 years old. Pardon me. Take this out. He's 77 years old. Eats meat and still healthy. He still can move and work. And so it's all about balancing. You got to take care of yourself. You got to do regular detoxes and know exactly what's going on with your body.
Do the different shapes of the eye mean different things? Like some people have, like I got big eyes, some people have chinky eyes,
Mm-hmm.
some people have
Yes.
beady eyes. They say beady eyes. Do the different
Mm-hmm.
shapes mean different things?
Yes, it does. So if you have like, if your eyes is like low like this, that shows like weak adrenals. Mainly the pupils will let me know the state of the adrenals and the thyroid. If your eyes is always like this, like bulging, it can show like, you know, excitement or like hyper thyroid. It depends on the individual. It depends on if I look at the pupil as well, because the pupil also is very important. I meant to mention that before you asked me the different parts of the eyes. The pupil is also really good at diagnosing the colon and the nervous system.
Mm-hmm.
So yeah, it can tell you based upon the shape and, you know, the size. It can tell you someone's personality. Usually, if you have low eyes, it deals with like, you know, fear, going back into the thyroid, because the thyroid and the adrenals are emotional glands.
Indeed. Somebody said Lil Durk eyes. Yeah, they be saying that. They be like, yo, you rich, you look like Lil Durk, man. What about you know what? What about people? I noticed when people, like we was talking about melanated people, when they get old, sometimes their eyes turn blue, like they lose the pigment in their eyes. What does that mean for you to lose the pigment in your eyes when you get older?
So that deals with lymphatic and venous congestion. So anything blue around the iris, that shows that the veins are congested. So most times they'll have knee problems. They'll have severe blood circulation issues and lymphatic issues. So that ring really starts, maybe it depends on an individual. I've seen it start around late 20s, 30s. And then by the time they get to 60, they're having issues with eyesight. Because once that ring covers the entire iris, then that usually lets me know that there's cataract forming or there's a cataract present. That all deals with venous, like vein congestion and the lymphatic congestion. But that starts early. But again, we're eating fried foods every day. We're eating cooked foods every day. The average person don't take a break from cooked foods. So you're eating oil, you compacting, you're causing all of this plaque build up in your lymph. And the lymph is one of the main elimination channels. So if that starts to clog, then all of the other elimination channels cannot, you know, release and do its job, like the kidneys and the lungs. So yeah, that you want to cleanse your lymph and blood cleansing, blood circulation when you see that ring, that deep ring.
Indeed, indeed. In terms of the eyes, when you're stressed,
Mm-hmm.
what is that? What do you see in the eyes when somebody? Because you know sometimes you see somebody and they got the red. What's that called? The red thing in the white part of the eye.
Like veins.
Yeah, like veins. It'd be like red veins everywhere.
Okay.
Is that stress? Like if I see my eyes and I start seeing red veins, I'm like, oh shit, I'm stressed. I must be stressed. Would that let me know I'm stressed?
The red veins, it depends on where it's pointing to in the iris. The red veins don't necessarily mean stress. I'm going to show you an iris of what stress looks like as far as um, what we can look for when it comes to looking at the nervous system. But red veins, usually if it's pointing to a specific part of the body, then that'll just show where that area that needs help. So I just sent it to you because I don't want to, take long again.
Okay.
I don't want to take I don't want to take up the time. So I sent it to you so we can share it.
All right, I did not get it yet. Give me a second, family. Here we go. All right, let's pull this up. Okay, give me 1 second, family. All right, what we got going on here?
Okay, so if you look at first, we're going to talk about that, the presence of parasites in the drug spot. But this iris also shows an overactive nervous system. If you look at the rings, that lets me know the state of if you're like nervous, stress, what is called anxiety. And then depending on how many nerves. So based upon this iris, this person is supremely stressed, meaning like they're like almost to the point of like what is called like a nervous breakdown, where they have anxiety attacks or what they call panic attacks. So, and then you see this vein here, which you were asking before, depending on where it's at, where this is more so pointing to the chest area, the lungs. So stress has
wait. Where's the vein you talking about? Because
right, I mean, I have it on my cursor, but you can't see my cursor, but you see that red vein on the left side of the right iris.
Okay, yeah.
So those veins, you see how it's like pointing to the iris. So veins pointing to the iris lets me know what area needs help. Okay, that area is more stressed due to the person's mind state, their mental state. And all of this, again, what I teach my clients is everything starts here in the mind first, and then it shows out in your iris, and it shows out in the physical after it starts here. So in the nervous system, again, this dealing with also you see the parasite area, the colon and the nervous system go hand in hand, because your colon is your third brain, your third nervous system. So all of that, the presence of parasites, all of that affects a person's mental state. So yeah, that's how you can see in real time the nerve. It's called nerve rings, or what is called stress rings.
So what this is like a magnified picture of somebody's eye?
Mm-hmm.
Okay.
And I have permission. Every client I get, I sign a disclaimer, y'all. Okay, I'm not just sharing photos.
Don't have nobody coming after my channel now.
Right. No, they sign a disclaimer, and to share their photos, because some of them take really good photos. So I'm like, please I need to teach on this. So yeah.
Did you talk about that drug spot already?
Nah, we didn't talk about
what's up with that? Like somebody's on cocaine, dope, people take pills now, or somebody's an alcoholic. Do you see all of this within the eye? People who use drugs. Okay.
And in fact, when I was 2 years old, I've been going to an iridologist since I was 2. And I'll tell a quick story before we get into it. My mother took me, and my brother were twins, and we were on amoxicillin because we had an ear infection. And the iridologist said, he just looked into our eyes and said, "What are you giving these children?"
Wow.
And she was like, "What do you mean?" She didn't really know what to do at the time, for our ear infection. So after that, she never gave us amoxicillin again, and she just started giving us, garlic oil. But with this drug spot, that deals with drug medication, any other hard drugs like cocaine, pills, all of that. When you ingest this constantly, it hypers the liver, but also it'll settle. It's called a drug settlement. It'll settle in the weakest organ or weakest area in the body, and this area is settling in the esophagus, which it shows me that the esophagus, the throat is becoming damaged. So it's in between the esophagus and the right shoulder. So they also have issues with calcium. So you can also look at a person and see mineral deficiencies what minerals they're lacking, what they need to eat more of, what they need to take more of. So these drug spots, every time you take drug medication, it's not just coming out of your body, it's actually settling in the weakest organ of your body. And also it'll darken the colon area, which is around the pupil.
See, when you start the show, you said you've been doing this for 5 years. You've been doing this your whole life. Your mama used to take you, man. This is a destiny for you. You trying to
Yes,
show
it
off. You
will.
trying to show off. You like 5 years. You've been into this your whole life. That's how you know all this stuff.
Not for real, and I really give thanks to my mother. You know,
Yeah,
it's
facts.
it's been a year, you know, since she transitioned, made her return to the spirit world.
Oh
So
man, bless
she
her.
really, you know, her and my grandmother, you know, may they rest in power. They turned our family on to iridology. You know, my mother. I tell you the story of how I got turned on to it. My mother told me that she went to a doctor, the medical doctor, because she had severe pain on her right upper side and she could not figure out what it was. And the medical doctor couldn't figure it out what it was either. They ran every test, they checked everything. They said, "We don't know. We're gonna send you home with this drug medication. Hopefully the pain will go away," but it didn't. And my grandmother was like, "I told you to go to that iridologist," you know. So my mother, you know, without nothing to lose, she goes. In 2 minutes, this is her words, 2 minutes sitting in his chair, he told her that you have gallstones.
Mm.
That's what it is. He's seen her gallbladder. He gave her a remedy. She passed the gallstones, and by 3 days later, no more pain. So at the time, I was trying to figure out, okay, what am I supposed to do here? What is my purpose here? What am I here to do to serve? And boom, it clicked. And then that's when here we are today.
Beautiful story. Shout out to all the mothers who expose their children to their destiny at an early age. That's a beautiful thing when we get exposed to what we're gonna do when we get older at an early age. So shout out to all the mothers and fathers, grandmothers as well, who are responsible for that. I'm gonna ask probably about 4 more questions. Then we're gonna get to Q&A because they are asking a lot of questions in the chat. They
Ah,
they gonna be hitting up your phone all day and all night. So we gonna to
let's
continue.
do
You
it.
know, we've talked about the health problems. What about somebody who's in love? What do you see? I mean, I don't know if you ever see, if that's something that, because people usually come to you when they have problems, but what would love show in the eye if that's something that you have ever researched or studied? Like people usually say you glow and shit like that when you're in love. Is
Mhm.
there something you can see in the eye when a person is just full of love?
Oh, like their heart chakra is like at a
Yes,
high state.
yes, yes.
You know, I have not, you know, gotten into that. Now, as far as reading auras, you
Hmm.
know, and as far as, because when clients send me their photos, I'm not just looking at the eye. Sometimes they'll send like part of their face,
Uh-huh.
so I can, you know, kind of look at the energy of their face, even the lines under here, just looking beyond the iris, and seeing, you know, how their energy state is, you know, if the heart is open, and also, not to, still on topic, I can see what chakras you need help with the iris, with each area of the iris. So whether you need focus on your throat chakra, your heart chakra, your solar plexus. I have a video on my Instagram showing that the iris and chakras are connected. But as far as like your question, I have not dived into that, but in a way, I can see the energy of someone's heart based upon their photos.
Indeed.
Mhm.
So let's talk about, they say that your eyes are the windows to the soul, and we always hear about people talk about eye contact. That's
Mhm.
something that we have been told when we since we were young, always make eye contact.
Yep.
And you hear that from a lot of people that are conscious, eye contact is important. If I have a guest on my show who's wearing sunglasses, people will get mad, like, why they got the glasses on? I can't see who they are. Boom, what are they hiding? Now,
Right, right, right.
now, me big, I'm gonna be honest with you. Me big, I'm not big into eye contact. I'm not. I'm just, and I know that goes against everything the conscious people say. I'm not big into just. I feel like people are vampires sometimes, and I'm an empath, and I got a lot of psychic things going on with me. And sometimes when you see a person really wants energy. That's why they keep asking about the eyes. So it's that's just me personally. But I want to talk to you. How do you feel about looking into people's eyes, always establishing eye contact?
Because that's how you can tell who a person really is. You
Mm-hmm.
know, looking in, because again, the eyes are the reflection of the soul, the spirit. So if I'm looking into someone's eye and it's dark or they turn away, it usually lets me know either they're hiding, or again, if the color is very dark, it just lets me know that the spirit, whatever they're going through, has just clouded their entire energy, where they have no light in about them, no there no heart, or with no heart, not necessarily no heart, but no high spirit. So I definitely encourage I have a video on the power of eye contact, looking into someone's eyes and being able to see who they are. And then you start to feel, you can actually feel the energy, as far as you start to shiver, or you start to like just feel like you start to get hot, and then some people, when I posted that video, someone was like, oh, this is way off, and her eye contact is not good. Looking in someone's eyes, they can pierce your spirit and take over, or something like that. I'm like, well, that's why you got to keep certain pieces on you, certain protection on you, certain jewelry. All my jewelry that I wear is not for no reason. Every single ring you see, every piece you see is some form of protection. So, you have to look at that and not be afraid to look into someone's eyes, to really look to see truly who that individual is.
Indeed. Once again, family, shout out to everybody in the chat. I'm about to take Q&A in a second. We having a great conversation on the eyes, an amazing conversation. Since we're talking about eyes being in the window of the soul, we just finished talking about energy vampires and I think they call it gazing. The vampires, they would practice gazing in the eyes and shit. Like,
Mhm.
what what is it? Talk to me about on a more, we talked about iridology on a health aspect,
Mhm.
but more of a soul aspect.
Mhm.
What is it about? Because I had a conversation with what's it, the Dr. B Serious,
Mhm.
Dr. Serious B, Dr. B said, not Doctor, what am I, what is his name? Dr. B Serious, yeah. And we were talking about how we have been lied about the role of our eyes. Now, people
Mhm.
say your eyes are actually instruments that you use to see your mind. So it's really, we're really not seeing the external world. We're really seeing our mind, but the eyes are the instruments that we use to see our mind. So
Right.
yeah. So could you touch a little bit on that, on a more metaphysical sense of the eyes?
Right. So yeah, the eyes are just an extension of the brain. So
Mm-hmm.
really what you're when you look in, it's really to scan the environment around you. And you even look at the eyes, the cells of the eye, of the retina, and also the cells of the pineal gland. It's one and the same. So when you're using the eyes to scan, more so the environment around you, you can actually wait. I'm actually losing. Can you remind me of the question again? Because I forgot real quick. You said
The eyes being an instrument that we use to see our mind, and how you talked about how it's an extension of the brain. I think
right,
it's the
right.
only part of the brain that we could touch. Is, you know what I'm saying? So talk
Hmm.
to me about that. Like, we're not seeing the external world, we're seeing the inside of our mind with our eyes. That's what I've been what I've researched and what a lot of the teachers come on here and talk about.
Hmm. Right. Yeah. More so what I've studied when it comes to that aspect is more so everything your senses, but the main sensor is the brain. So you're seeing with your brain, you're touching with your brain, you're tasting with your brain. All of that is more so the nervous system and the brain. The eyes are an extension of not just the brain, but the nervous system. So that's even what we're looking at when it comes to the iris, when it comes to iridology. So as far as seeing in the mind, at this time, like I'm not able to really dissect in the way that you're asking the question. So I don't want to really go into that depth of seeing into the mind. But as far as the eyes being more so to an instrument to scan, basically to scan your environment as the body, but more so it's more so looking into, it's more so an extension of your spirit, more so an extension of your brain. And so that's why when you look into someone's eyes, you can see the, you know, if it's glossy, if it's low, you can look at the energy and kind of like, you know, be able to tell, oh, what's wrong with that person? You know, you start to ask questions because you can actually, the eyes will always tell the state of a person's spirit, even in its current, you know, whether you know, again, if it's if they have challenges going on, not just on a physical level, but on that the spiritual level, the metaphysical level as well. Because again, no disease can happen in the body without consent from the brain, without consent from the mind. And each part of the brain is connected to an organ. So whatever part of the brain is malfunctioning on any level, then it'll let me know what organ you need to work on, what emotional health that you need to work on. So that's what we'll be diving into as far as accessing the polarities of your personality when it comes to looking at the iris, the markings, the brain, so that you can operate on your highest self possible. And that's what we're here to do. You know, we come here to learn ourselves, yet we're like, we're trapped in this this mindset of doubtfulness and what is called anxiety and depression, all of these things, because we do not know ourselves. And so without the blueprint that you come here with, you know, you cannot, you know, access higher divinity about yourself. So that's what I'm doing. We're doing with this workshop with iridology and the numbers. So, you know, I'm excited for everyone to tap in so that no more guessing, you know, let's really know who we are on a higher level.
Let's get to some questions. They are asking a million questions in the chat room. We're gonna get to some Q&A. Before we do, make sure you hit the like button. Also, leave before we get into Q&A, because some people don't make it to the very end of the show. So tell the people about the workshop you and King Simon is doing before we get to Q&A, just in case they don't make it to the end.
Absolutely. So we're doing a workshop February 11th, 2023. The inner alignment through your eyes and your numerals. So we're combining these two ancient systems together so that you can access your divine blueprint through your eyes, your iris, and your numbers, your numerals. So I'll be teaching, you know, the mystery to longevity and how you can access that longevity through your iris. Also teaching on children's health in the iris. You know, if you guys go on my Instagram, you'll see I did a whole live showing children's irises and what they can possibly suffer from if they lead a certain lifestyle. So the iris of a child, it's the symptoms are not going to be great enough to feel. But imagine you have a baby, a 2-year-old, and I look into their iris and I say, well, you know, they're not able to have bread. You know, that's why they have stomach issues or they have constipation. Your son may have prostate issues in the future. So make sure that you have these herbs on hand. Make sure you do this for him. Make sure that you write all of this down in a notepad so you're passing down that generational health. That's what it's all about, that legacy right there. So that's what I also do for children. And I only take children 2 years old and up because, you know, they don't sit still. So also, again, I'll be teaching disease, trauma, and inherent weaknesses. That's a big topic that we got to talk about because we have so much trauma that starts to play out in the body, but not just on us on our level, but what mom had or what grandmom had. And we automatically think that we're going to have that. So it just helps you to look into the iris, look at certain patterns that you can just take home with you after the workshop and be able to see how you can avoid that. That disease, trauma, and inherent weaknesses. So we'll be talking about that and so much more. And again, I've never taught, you know, I've been asked, you know, when I'm going to start classes. I'm actually working on my teacher certification. So this summer we're looking like we're going to have classes. But as far as a mini master class on iridology at this level, don't miss the workshop, because that's the only place you're going to get it.
All right, all right. Let's get to some more questions. Somebody, I wanted to. Where is this at? Where is it at? There was. Okay, is it possible to tell if a person is enlightened, pineal activated through iridology?
Yes, I would say yes. If we can pull up the brain iris. I don't know if you can that same photo that you had, so that we can look at that, because I have a few more photos so that we can.
Which one? This one?
That one. Let's look. Did I send you another one, or no? That was the only one.
No, just this in the chart. That's it.
Okay. All right. So we'll use that one. Okay. So here, all on the top here is the brain area, and again, it's looked at as a clock. So like from 11 to 1 o'clock is the brain.
The top of the what? The top of the iris, or the top of the white?
The top of the iris from. Oh, I'm using my cursor. I keep thinking that y'all can see my cursor. Pardon me for that, family. So in this, I'm trying to point, but in the region above the pupil on the top is the brain. And it'll show different parts of the brain, like the pituitary gland, the pineal gland, all of that. So in this area, I can tell based upon in this iris specifically that that the level of the pineal function and the pituitary function is low. They'll have reproductive issues when it comes to the breast, because the pituitary, all of that is connected to reproductive, like the hormones, specifically prolactin. So that'll also have a lot of issues there. But yes, you can tell a function of someone's pineal based upon the brain region. And that's why that's why I love pictures like this. Some clients, they get frustrated with me because I have to tell them to take their photos over, but I need to see the brain so that I can see the mental state and what is connected to each organ, not just telling you what foods to take, but helping you on a spiritual level, helping you to rise up, on that aspect. So yes, you can see the function and state of someone's pineal gland in the iris.
Excellent. What crystals do you use for eye protection?
Crystals. As far as eye protection, I don't necessarily use specific crystals. I have to look into that. For eye protection, I use like my eye drops. But I am going to definitely look into the crystal for eye protection. I got a lot of crystals here. I got to look which crystal will help that. I got a whole bunch of crystals around. But as far as eye protection, I use my eye drops. It's called the Eagle Eye Drops. And I used to wear glasses when I was a teenager. And when I started cleaning up my diet, I started, stop eating sugar, because I was a sugar addict. I love sugar. And I stopped doing all of that. I don't wear glasses anymore. Plus, I was taking, I didn't have this made at the time, but I was taking the herbs that I put in this Eagle Eye Drop. So I take this, even I don't have any challenges now, but I still take a couple drops daily, keep me sharp, keep my, because I train in martial arts, so I have to be able to, see, from a far distance. So that's some of the ways I protect my eyes. I also, use blue light glasses. But as far as crystals, that's a good question, family. I definitely got to look into what crystal is good for eye protection.
Okay. What does it mean when you look into someone's eyes and then your body temperature increases?
Like my body temperature increases?
No, somebody in general. Like if I was to look into somebody's eyes, then all of a sudden my body temperature increases.
Oh, okay. So if you're looking in someone else's eyes and your body temperature increases, that's you accessing the vibe, accessing the vibration. So if your temperature increases, that just shows that you need to be on alert. If you looking into someone's eyes and you start to feel hot, you start to feel pressure, then there's something not right about that individual. Not saying that they're evil. They can have they can be sick, they can be ill. Um, I said something on another show one time where I had a sister. We did a show together, and she was sitting right next to me, and I was feeling like real, just not jittery, but I picked up on the energy of what she needs to do. As far as I picked up on her thyroid and her kidneys, and I said in the show, I said, if a random person walks past you or they look at you and they let you need to, take care of so and so, how will we feel about that? Some people say they get spooked, like, what are you talking about? Like, why are you telling me this randomly? But sometimes I don't even need to look into your eyes and tell you what kind of what diseases or weaknesses you have. Your aura, your energy flowing by me will let me know that. So if you're looking at someone's eyes and your body temperature increased, that person may have an illness. They may be sick, or they may have bad intentions. So that's usually what that means, family.
All right, next question. Do brown eyes have more melanin than others?
Yes, the darker the eyes, the more melanin a person has. I've seen all different color irises, such as light green, blue, dark brown. So a person who has darker brown eyes will have more melanin present, because that's what the iris is. The iris is the color part of the iris shows the melanin activated in the body. So the more darker the iris is, the more melanin the person has, and the more lighter, like the blue eye, that shows the melanin recessiveness. So as it goes lighter, again, not to repeat, but it just shows that melanin recessive. So yes, it does show that the person has more melanin.
Somebody keeps asking, what about folks that wear glasses? They didn't elaborate on that question, but
I can kind of understand it.
okay.
So glasses are just a band-aid, family. It doesn't correct the problem. You go to an eye doctor, you take your children. This is another one that they get our children with, with these eye tests, and then they tell us, our children need glasses, and then we get the glasses, but it doesn't really do anything. You're wearing glasses your entire life, so it just covers up the real ailment. It's not fixing anything. It's not doing anything. So I had a client. This testimonial blew my mind. I kid you not. She came to me. I was at an event, and she said she was using my eye drops, and her doctor prescribed her a specific eyeglass prescription months prior. And when she went back, she said it was blurry, and the doctor said, well, you don't need these prescriptions because it's too high. She was like, well, you gave it to me. But she was taking this for 6 weeks after she went to her doctor. So you got to get all that mucus out. That's what it is. It's like a mucus crust that is blocking you from having that higher vision. Not that 20/20. Don't subscribe to that 20/20 and all of that, because that's how they get you with the glasses. So you want to get that mucus crust out of your eyes. Once you start taking this, the next day the mucus will start pouring out, and then you start to have a clearer and brighter vision. So yeah, with glasses, it's just a band-aid. You want to really heal to the root.
When we talked earlier, and I mentioned about when people get older, sometimes their eyes, those who have brown or black eyes, their eyes get lighter and they change colors. What's interesting about bringing that up is that when you get older, your eye turns lighter. But when you're first born, I remember my son is 4. When he was first born, I seen him come out the womb. I was there for everything. His eyes was jet black, like he was an alien. Like jet black, like an alien. I was like, oh, my little alien baby. So what is it about? Why do you think you will come into this realm with just jet black eyes and then leave with blue eyes? You come in this realm with jet black eyes. By the time you 80, you getting out of here, your eyes is blue.
Usually it's the other way around. Usually usually it's like lighter when you come into this realm, and then it gets darker, because the more darker as you go through life, quote unquote, happens to you as far as your choices, then the darkness will begin to change the actual color of your iris. But if your son was born with jet black eyes already,
Black,
that is
black,
black.
black,
Yeah,
black. You look like an alien.
yeah, that showed, that's the power right there. And then what color is his eyes right now?
Brown.
It's brown.
Yeah,
So
brown.
you couldn't really see in the iris. It was just black as the pupil,
It
like
was black.
black
Yeah,
as
it
the
was black.
pupil.
I'm talking
Yeah,
about day one. Day one. You the first
day
day he was born.
one.
Yeah.
Wow, that's powerful. I've never heard of a case like that of a child
Yeah.
being born with jet black eyes. Like I said, it's usually the other way around. But that is something I would really need to look into and study. But off the top of the head, I would say that's your son is definitely a different special soul coming in with that jet black eyes. And it was it almond shaped. He got almond shaped eyes like you a little bit.
Yeah, it's just like his eyes, just like me. Yeah,
Yeah,
just like me.
yeah.
Yeah. Let me somebody, they keep asking about your eye drops. Please tell them. They don't ask it. Please tell them where they could get your eye drop. Oh, god damn, y'all, calm down. Please tell them. Please tell them.
Yes, you can get it on my website. I don't know if you have my link. Is www.holisticapalace.com. HOLISTICA palace.com. And I've seen questions about astigmatism. It helps with all eye challenges. I put each herb to target each ailment. Like for floaters, it helps get rid of floaters. It helps with cataracts, the effects of glaucoma and macular degeneration. So that eye bright is in there, ginkgo, red raspberry, bayberry. So many different herbs to target and increase the circulation behind the eye.
Okay, all right. There you go. There's so many good questions in here. I'm just reading them.
Yeah, and I have a few more pictures, but
Yeah, show the pictures before we show the pictures, because we passed the hour, but we'll be here to 2 a.m. messing with y'all, man. Yeah.
So
you got to email them to me, right?
I'm gonna email it to you. This next photo I'm gonna send is more so looking at how the iris looks after someone detoxes. So
okay, great.
So I'm gonna show you an iris before the detox. I'm making sure I'm sending it to the right email. Give me 1 second. Yeah, I'm gonna make sure. There we go. Give me 1 second, family. The iris here. All right, you should be getting it. Now. All right. Yeah, I just sent it. So I want to show that iridology on this level that
you sent one picture, right? I'm sorry, you sent one
I just
picture.
Sent one sent one.
I'm just making sure. Let me pull it up. Give me a second, family. Share the screen. All right, go ahead.
Okay, so the iris, we're going to show an iris next, another iris, so you can see how the iris changes after you detox it. So I have photos when clients come back before in 6 months, so that they can see the changes in their own eyes after they follow the program. Matter of fact, I had a customer that was a client that was so bold. When he seen his photos change, we went live on Instagram. He's like, I want to show the whole world what I did. So as you see, is dark. And also not even just the iris itself or looking at the disease factor, but the emotional health attached to the person, the core of their vibration is just this person, based upon I've spoken to I've had this client in real time. They had a lot of issues with work, constantly stressed, issues with just home life. But it wasn't just the outer aspect. It was their own way of their own perspection, what they were not doing to keep themselves in a flowing state. So I let them know, okay, this is what activities you need to be engaged in. This is what you need to do. They now know how to access their personality trait so that they know what they need to keep themselves high, not just looking at the food aspect, but the mental and the spiritual aspect is very important. So I connect all of the dots. So I'm going to show you the picture of the iris after they detoxed, which is amazing. I'm going to show it to you. And again, family, these are all photos that I get from my clients after they iris read. A second. So I sent that to you.
All right, just got it. Give me a second, family. This is before detoxing. Let me.
Did I show you? I sent the after, right? Yeah, I did.
No, you sent the before one. Hold up, let me make sure.
Yeah.
Oh, no. I'm sorry. Yeah, I pulled up the wrong. Okay.
Mm-hmm. And then you see, before you go to the after, you see
Yeah.
how the pupil is big. It's like enlarged. So when it's in that state, that just shows the adrenals. Again, the stress factor. And again, I can't put my cursor on there, so I can't really show y'all exactly like where the markings are and what the organs are. But even if the white areas around the pupil, that's acidity. Okay, happening all in the body. Now, when you pull up this next photo, after 6 months of cleansing, and I had a client, oh man, just doing a lot of grape juices. They really followed through. So you can pull up the photo.
All right. I'm trying. I wish I could do a side by side. Let me give me a second.
Yeah. I wanted to.
I'll figure it out while you talking. So this is after the detox, family.
You see how the people became smaller?
Yes.
You see how the people, because now the emotional balance was there. Now the adrenals are not hyper anymore. It's the person is more calm. The person not only detox on a physical level, but also did a lot of their own meditative practices. They started following the suggestions that I had for them of the best activities and best things that they need to be into, what chakras they need to work on. So there's still a lot of work, of course, that will still need to be done, but it's a huge difference from like I said, when you was asking about the dark to the light. Usually it's a person is born with light eyes and then it turns dark. And now you can actually see the true color of a person's iris. This person color is a green. So now before you couldn't tell that. So also I can tell a person's original eye color based upon when they send me the iris photos.
All right. And give me a sec. Let me get to another question. I'm gonna pull up. I'm gonna find a way to pull up, do it side by side, because this is then y'all really could see the difference. We're gonna get to we're gonna get to a question. While you're answering that question, I'll set it up. Let's see. Somebody said post corneal. Yeah, transplant. Yeah.
Can you have an iridology reading? You can. I've had clients who had what's that other, it was it's an eye, I forgot the eye surgery where they correct their eyesight. But yeah, LASIK, right. You can get you can have an iridology consultation post corneal transplant. I've done consultations for those who cannot see, who are blind. So yeah, you can. Yes, you can. No, you if someone asks about contacts, you have to take your contacts out. And I've seen a question before about contacts stuck in the eye. That's something that you got to go to a medical doctor for. So, but yeah, post corneal transplant, yeah.
I'll try to do it. Let's just get to another question.
Okay, that didn't work.
Anemia in the iris. Is there a way to spot anemia in the iris?
Yes. Anemia in the iris is usually shown in the spleen area and also around the iris. So when we look around the iris is, that's called the rim, the scurf rim. If it's very dark, if it's very brown, that'll show issues with the blood, toxins in the blood. The spleen, markings in the spleen will show me that you have challenges with red blood cell production. As far as the spleen's responsibility is to break down old red blood cells so that new ones can form. But if your spleen is not working properly, you're having all these old red blood cells without new red blood cell production. So that's how anemia starts. There's also something called brain anemia, where the other irises that I showed y'all, if there's a really dark brown ring above the iris in the brain area, shows that there's a lack of blood circulation to the brain. So people are trying to figure out why they have all this the brain fog, mental fatigue, they can't think straight. It's because you have to start cleansing your blood. You have to start cleansing your lymph as well. You have to, and the spleen is a lymph organ. So yes, you can tell anemia in the iris. Matter of fact, I had an iridology look in my eyes when I was like a few years ago to see if he said I had slight anemia. I took chlorella for like 6 months straight, and I no longer fear winters anymore. I used to, I used to cry in the winter, y'all. When it comes to anemia, but taking chlorella, cleansing your blood, chlorophyll, what else? Herbs like sarsaparilla, dandelion, burdock, bloodroot, all of those will boost the iron.
And this is just now after the detox is on the left side. So that I messed up, but the after detox is on the left side, and before detox is on the right. Now that's a hell of a difference.
Wow. And you see the pupil change. You see the darkness. You see how the markings in the iris is starting to open up. So areas, I wish I could point to it, but if y'all see like these open holes, put some 4s in the chat if y'all see like open holes in the iris, so that I can really show y'all exactly the difference. So those open holes tell the state how deep a person's issue is. And on the left side of the after detoxing, you start to see those holes open up. So that means that the detox is working. They're able to, whatever the acids that was trapped in that specific organ is now evacuating. It's now leaving.
Yeah, so I just had to. I worked hard to put this together, y'all. But
I give thanks.
This was so amazing. I'm like, wow, detoxing could do this much for you. Wow. So yeah, that's how important detox is, family. We're gonna get to a few more questions before we get out of here. It's been a great show. Shout out to King Simon in the chat. King Simon, I seen you. Shout out to Billy the Goat. I seen Billy Carson early in the chat. Shout out to Forbidden Knowledge and everybody else who's watching, and everybody who's watching right now. Wow, great show dealing with the eyes. We're gonna have a couple shows this year dealing with different parts, organs of the body, family. So let's see. Somebody asked earlier, I don't see it. 2 different color eyes. When somebody has 2 different color eyes, what's up with that?
As far as one is green and one is brown?
Yeah.
Okay, so they would have 2, what's the word I'm looking for? 2 personalities when it comes to dis-ease and the spiritual aspect. So I've never had a client with that case, but I've seen a green eye and I've seen a brown eye. So a green eye deals more with thyroid challenges, and I believe pancreas challenges, if I'm not mistaken. And the brown eye again deals with the blood, the heart. So they'll be more prone to both of those challenges. As far as on a metaphysical, spiritual level, that I have not really dived deep into the difference between the irises on the spiritual aspect. Just understanding more so of what a person would be prone to as far as dis-ease wise, and that personality of their inherent weaknesses. So Yeah, that's an interesting case I have not come across personally, but I've done a little digging on it.
Somebody asked, do you have anything that helps with migraines?
Yes, I do have a migraine blend that we did not release on the website yet, but I do have white willow bark. White willow bark is literally nature. It's called nature's aspirin. So a lot of the aspirins that you see on the market today, they use the properties of white willow bark in aspirins. So like it's called salicin. So they'll put that in aspirins for the pain, but you got to get to the source of which is the herb itself, the white willow bark. So yeah, you can go on my website and see that. Also, linden leaves and flower, really good for migraines. But we do have a migraine blend hitting the website. I believe Monday we have it hitting the website.
Somebody keeps asking floaters. What are floaters in the eyes?
Floaters are signs of the retina. Okay, it's signs of the retina detaching. So you don't want to take that lightly. That's like the early signs of retinal detachment. So with that, that's why I put ginkgo. A lot of people don't know ginkgo is not just good for memory, but it's good for blood circulation behind the eyes. I used to have an eye model, but
You talking about ginkgo biloba? That's
yeah,
what you're okay.
yeah, ginkgo biloba, yeah. So ginkgo is really good for circulation, especially behind the iris. You have a lot of blood vessels behind there, and if you have issues with blood pressure, circulation, then the eyes will suffer as well. So ginkgo, putting ginkgo in my eye drops really targets floaters. Also, the red raspberry, the eye bright, and there's I can't think of off the head. I put so much. Okay, so bayberry, eye bright, raspberry leaf, ginkgo, and calendula. Okay, so yeah, floaters again. You don't want to take that lightly. That's dealing with the retina. Once the retina is detached, there's really no way to reattach it. They have so many different surgeries where people are getting, and it just makes it worse. So
Is there indication of too little sunlight? That's a good question because a lot of people, black people, need more sun and are vitamin D deficient because we're in these city areas and we don't even know it. So can you see if somebody is vitamin D deficient or is getting too little sunlight?
yeah, the lymph would tell that. Lymphatic challenges will, as far as the lymph buildup around the iris, that rim, that all coincides with low vitamin D levels. So as far as that ring that you were discussing earlier, the lymph deals with more than just the plaque in the body, or that blocked elimination channel deals with the mineral deficiencies that a person has as well. So vitamin D, choline, all of that is what a person would need. So yeah, the iris can tell if there's little sunlight based upon the functioning of the lymphatic system.
Okay. Let's get to another question. Somebody wants to know, are you located in Georgia? You in Georgia? If they want your services?
No, I'm actually in Pennsylvania, family, but I do Zoom. If you go on my website, I do Zoom consultations. I've had clients all over the world, from Trinidad to the UK to Canada. So what you'll do is, once you book your Zoom consultation, you'll get an automatic email on how to take your iris photos. You send me your photos just like y'all seen on the screen. I look at your photos. We get on a Zoom call. We discuss your findings. You keep the recording for life so that you can remember that. And then if you want, I have something called the personalized detox plan, which you can invest in. And so that you have a step-by-step guide on how to detoxify for the next few months or whatever months that I suggest. So yeah, healing can happen anywhere in the world. I first learned that from Dr. Drew Pookrum when I first started getting into holistic.
What does it mean when your eyes twitch?
So that's dealing with the nervous system. As far as what they like a tick or so. So you want to definitely align your spine. That's dealing with the spine. I can also see the spine in the iris too. We didn't get into the skeletal system, but that's that. Again, we're gonna do all of that on the workshop, family. All of that on the workshop. So I would definitely suggest chiropractic, because we don't realize that we have poor posture and we sit in a certain position or we stand in a certain position all the time, and that affects our nervous system. So when you go to a chiropractor, they're just manipulating the nerves. And so when you start to, get chiropractic, acupuncture, taking herbs for the nervous system, foods, stop worrying, and also on a deeper level, if it's like more so dealing with what is called like the tic syndrome or Tourette's, there's different tinctures that you can take for that. I've had 2 clients with that challenge, but I find that that's more so an inherent weakness, and I've actually had to get advice from Baba Phil when it came to that. But yeah, eye twitches deals with the nervous system. Okay, so chiropractor, acupuncture, aligning your spine, getting the electricity to flow into your body, activating your meridians. Definitely want to work on that.
Mm-hmm. Can you hurt someone by looking at them bad?
If they abuse you,
Abuse you?
if they
Yeah.
abuse you to protect yourself, can you hurt someone by looking at them bad? I mean, if you're looking at them with intentions to cause harm, if you're looking at them long enough, you as far as that aspect, then yeah, you can kind of, depending on what kind of spiritual practices you have, you can possibly cause harm to someone, if you look at them with those ill intentions on that level. So yeah, it depends on the kind of power that you have. What intentions are you putting behind it? But I wouldn't suggest that. I wouldn't suggest that.
Yeah, I would have suggested don't do that.
Don't do that.
If you're being abused, there's other ways to go about it than by
Right.
trying to harm them by looking in their eyes. There's a lot of other
Right.
ways that you could get help.
Especially for women. Yeah, for women, if you're in that situation, of course, yeah, like Brother Rich said, there's other ways to help, but also as well, we have to really start as women to start to get into different trainings, to learn how to protect yourself in that way. We ain't gonna go into the martial arts world tonight. So, but yeah,
Yo, you done mentioned martial arts 3 times. Ain't no brother. Yo, they ain't gonna mess with you. Don't worry, man. She done mentioned. Well, you be study with King Simon with the martial arts.
No, I studied under my grandmaster Dan McEady,
Okay.
in the angelic system. He studied under Sensei Ronald Duncan,
Ooh,
under
okay.
a ninjutsu.
Ronald Duncan, yeah, yeah.
Yeah, so he know Dr. Moses Powell. They were brothers, so yeah,
Awesome,
definitely got
awesome.
a powerful lineage there.
Nah, that's awesome. That's awesome. I'm glad more sisters should definitely study the arts. Definitely. We're gonna get to 2 more questions and then we are getting out of here, family. Are there exercises to correct myopia without surgery?
Yes. Eye exercises, simple eye exercises where you're looking up, down, left, right, even when you're just like sitting at your desk or sitting anywhere. I do suggest eye exercises more so in the daytime, not at the peak of the sun. So between the hours of like 11 and 3, and while doing breathing exercise, because that will also enhance blood flow going into the brain and the eye area. So yeah, eye exercises, just simply looking up, down, left, right, because you have 6 eye muscles. Those eye muscles need to be worked too. So yes, and then also the eye herbs for the eyes, the eye drops, the eagle eye drops, y'all. That's why I call it the eagle eye drops, because eagles can see, like they'll be high up and they can see everything clear on the ground. So that's what the goal is of these eye drops.
1 second. All right, this hold on. Give me a second, family. They want to know about immune inflammatory diseases.
Okay, is there a specific one, or just you want to know in general? Like as far as can you see it in the iris, or you just want to
Yeah,
know about it?
yeah, I just see them keep putting that there. Maybe you could be more specific, whoever asked this question.
Mm-hmm.
Although we're about to wrap it up, but it would help to Lyra. No, I don't see you writing anything. All right, what causes blurred vision and dizziness?
What causes blurred vision and dizziness? As far if you're feeling, if you're feeling that all the time, that deals with the part of the brain, we call it the equilibrium dizziness area. So that deals with lack of blood supply, blood circulation. Um, you want to get herbs that specifically for the brain. If you have a blurred vision, that depending on the age of the person, that shows a lot of stress, hyperadrenals, a lot
Oh,
of tension,
yeah.
a
Yeah.
lot of tension. So usually that person just constantly working, not slowing down, not taking a break, not relaxing. So you can possibly lead to what is called a stroke if you're feeling those symptoms all the time. So I can see that in the brain area is called the equilibrium dizziness area. So you want to work on your blood circulation, your adrenals, and your kidneys.
Mm.
Mm-hmm. And I did see that question with the autoimmune. She talked about sarcoidosis.
What's that?
She if you want to put, she just posted it on the
Oh, okay. Oh, I see it right here. Okay, this right here.
yeah,
Yeah.
yeah. So I actually have an eye photo with sarcoidosis. I don't know if you have time to share it. We can share it real quick, but sarcoidosis deals with the lymph. It deals with the lymph in the lungs. So mostly, if you have a backed up lymph, your lungs cannot um, eliminate waste the way it should. So you'll get like these patches in the lungs, and usually the iris, the rim of the iris will show a thick white coat. So when it comes to sarcoidosis, you want to cleanse. You want to focus on your lymph in your blood, and also lung breathing exercises, because that is a disease. When it gets to like stage 3, stage 4, it's almost impossible to breathe. I had a few clients with what is called sarcoidosis. So the lymph, working on your lymphatic, dry skin brushing, a lot of sauna, pomegranate juice. Pomegranates are very good for the lymph, flushing the lymph. Grape juice, seeded grapes, and then herbs for the lymph as well.
Yeah, I'm glad you something else that a lot of people don't mention a lot is the lymphatic system, and you and a brother named Yaki mentions
Mm-hmm.
that a lot. So that's something else we're gonna talk about this year, family, the lymphatic system. But and I just thank you for saying these terms that we're not used to hearing, and a lot of us is gonna go research and study. It's been a magnificent show. I want to thank you, Dr. Shakirah Moore, for coming on the show and putting it down. Oh man, this was a fun show. This was a real fun show, family. So I know you got the before you leave, tell the people about the workshop and tell them about your website. Some people say they already ordered some of your stuff while the show was going on, your eye drops and stuff like that. So, but tell them all the information before we get out here again, sis.
Absolutely. So February 11th, inner alignment through your eyes and your numeral. You definitely want to be there. You need to access your blueprint so that you're not constantly in a guessing mode. You need to know your path ahead when it comes to your health, your emotional health, how to keep yourself balanced. And I'm going to break all of that down and show you how to access that part of you that is not, it's not hidden, it's not a mystery, because you have it. So February 11th, you can purchase tickets on my link tree. I have one link with all of my links there, and the link is also on my website, family. To book a consultation, same thing. You can book a Zoom consultation from anywhere you are in the world. You send me your iris photos, and we go right into it. And I also have office consultations for those who you know, maybe in the nearby areas of like New York, Jersey, Virginia. I had people come down from Maryland. So, and yeah, so again, family, I'm in Pennsylvania. So, you know, you'll see that on my website as well.
Shout out to Adisha, who already got her Zoom consultation. I
All
hear you.
right.
Adisha,
All right. All right.
she ain't playing games.
No, no, no. Let's do this. No
Man, well,
hesitation.
I wish you and King Simon the best with your workshop in February. Like I said, family, this is something that we definitely need to study more. I look forward to hearing more about this later on about iridology. With that being said, I want to thank everybody for tuning in. Thank everybody for commenting. The questions were great tonight. Hope everybody was able to get some help. Doctor, I appreciate you. Thanks for coming on the show, and we should do this again sometime in the near future.
Yes,
and continue to learn about iridology. All right,
yeah, dive into it. Thank you.
Indeed, this Brother Rich family signing out. Peace.
Peace.